Good morning, everyone. Welcome to Providence Medford Grand Rounds for September 2025. Today, our topic is Rogue Valley Behavioral Health Resources for Older Adults, and we're pleased to have Janine Greenwell, who's the Older Adult Behavioral Specialist for Jackson County, present for us today. Janine has a master's degree in human services from Liberty University, and she has a passion for improving the health and wellness outcomes to better address the needs of older adults and looks for opportunities to connect within the community she serves. Good morning, Janine. Thank you for being here.
Oh, good morning, Dr. Webb. It is a privilege and an honor to be here, and thank you so much. And thank you to everyone else for taking time out of your day this morning to learn about older adult resources for in behavioral health in our local Rogue Valley. My goal for today is for you to learn about local behavioral health resources to better meet the needs of older adults, connecting them to systems of care to improve their quality of life. As Dr. Webb said, I work out of Jackson County Health and Human Services in the mental health department, and I am part of the Oregon Older Adult Behavioral Health Initiative. The Oregon Older Adult Behavioral Health Initiative was launched by the Oregon Health Authority in 2015. OHA funds and supports 24 specialists statewide in 36 counties. We create and sustain partnerships to improve behavioral health for older adults and people with disabilities. We also engage in collaboration and coordination in systems of care for older adults. We do that three ways. We offer free workforce development trainings. We do health and wellness community education, and we also provide complex case consultations. But we really focus on our stakeholder groups in our respective counties that serve older adults to better meet their needs. This is our website, oregonbhi.org. There's a lot of reports, fact sheets, a lot of our events and resources. The Portland State Institute of Aging evaluates the initiative, and they're the ones that create our reports. Here's a couple fact sheets that I wanted to share, specifically this one, the older adult behavioral health statistics between Oregon and the United States. So you can see the ratio of population for primary care providers in Oregon, as well as the ratio for mental health providers in Oregon. Another fact sheet that we have is the interface between serious mental illness and cognitive impairment. This fact sheet describes the cognitive and behavioral trajectories with schizophrenia, bipolar, and major depression, and helps providers differentiate between systems associated with dementia and cognitive decline. This sheet, Expanding Behavioral Health Services Through Medicare, provides information about how behavioral health services can be delivered under Medicare. It includes key information on Medicare annual wellness visit, which can promote behavioral health, along with other aspects of health and wellness. And this fact sheet further includes information on behavioral health integration services, as well, and most importantly, the CPT codes required for billing Medicare for these services. And the behavioral health services can also be delivered through incident to billing. So it is a resource. And then I like this one, assessing consumer decision-making capacity. This is a great little fact sheet. And as you can see that there's QR codes where you can scan to get connected to the formal assessment tools. We've recently launched OCEBA, which is the Oregon Center for Excellence in Behavioral Health and Aging. This is a partnership between Portland State University Institute of Aging and the Oregon Health and Science University, and OHA has funded this grant. It's a 2-year grant. And actually, we just had our OSEBA conference yesterday. It ended. It's an annual 2-day conference that's free to providers. We have some excellent presenters. And so I would encourage everyone to check that out. This is also on our website. There's a link at the top. And then this just brings me into why they created the initiative. We are an aging nation, and by the year, so this is the graph on the left, by the year 2034, across the nation, older adults are expected to outnumber children. And then on the graph on the right, Oregon actually outnumbered, our older adults outnumbered last November. And Oregon is one of 11 states that have met that threshold before the 2034 timeline. This fact sheet just shows Jackson and Josephine counties profiles, showing that we have a higher number of older adults in both Jackson and Josephine than across the rest of the state of Oregon. And then you can see there in Josephine County that the rural dwelling of population is much higher than Jackson. September is Suicide Prevention Awareness Month, and I brought this graph out of the OHA's Adult Suicide Prevention Plan, and just wanted to point out that men who are 85 and older have the highest rate of suicide in Oregon. And actually, because of this, the CDC has given the Oregon Health Authority and the Older Adult Behavioral Health Initiative some grant funding to really focus on some prevention and promotion through our community education classes that we each specialist offers in our counties. And I'll talk more about some of those classes later. This is a brand new safety suicide assessment sheet that just came out from SAMHSA. Actually, I just received it this week. So it's a 5-step evaluation and triage. I just wanted to point out that the populations at increased risk for suicide, that they do have older adults listed, and some resources. And then, of course, there's 988, Oregon's 988, that anyone can call, text, chat, and those that are deaf or hard of hearing also are able to access. And then we just wanted to share that Lines for Life also has a senior friendship line. It's a helpline available to Oregon adults 60 and older from 5:30 to 11:30 every day. It's a friendly, actually older adult that is well trained and answers the phone. They provide support, resources, referrals, grief, elder abuse prevention, suicide and crisis prevention. And then this is actually the flyer for the Senior Friendship Line. And so I have included this as part of the resources for you to share with your older adult patients. Social connection is huge. It's an epidemic, or social isolation and loneliness is an epidemic. And so any aging adult who is experiencing loneliness, isolation, depression, or anxiety can benefit from a confidential call with our senior line call counselors. And sometimes a friendly conversation with someone who cares and wants to listen can be just the kind of connection that someone needs. And this is a resource, the Oregon Psychiatric Line, or OPAL, and OPAL A is for adults. OPAL is available for immediate telephone access, and then as well as an e-consult. And the ongoing vision of this program is to expand the availability of high quality mental health treatment to all Oregonians through the support of their medical home. So via timely psychiatric behavioral phone consultation, they are also offering e-consults for non-urgent requests, practitioner education, primary care treatment algorithms, and promotion of linkages with private and community mental health professionals. And then on to some of our local resources. I'll start with our local Jackson County's community mental health program. We offer crisis services 24/7, 365 days a year. There is a direct link with the 988 line. When a caller calls 988, it's answered from a national call center, and then if the need is great enough, that 988 call will be transferred to our local crisis team. And then we have a mobile crisis unit that we partner with Mercy Flights, where they will go out as a team and do an assessment. I will share that 33% of our crisis calls here are for older adults, those 55 and older. We also have forensic and court-mandated services for adults, assertive community treatment for adults, and then we have an outpatient program, and then the Early Assessment and Support Alliance, as well as the Wraparound Care Coordination and the Parent-Child Interaction Therapy. Those are for our youth. So when it comes to finding behavioral health providers, either therapists or counselors, it can be a bit challenging because not everyone accepts just Medicare. So I did a bit of research. I just wanted to include here, psychologytoday.com is one that we often refer to, and that's the picture on the right there. You can go in, you can see a picture of the counselor, the therapist. You can see what kind of insurance they accept, their specialties, their credentials, whether they're licensed, whether they do in-person or virtual options, all just at a click of a tab. And then find out whether there's a wait list and whether it's a good fit for you. I also included the findatherapist.com, betterhelp.com, the ZocDoc.com, and then mindfultherapygroup.com. So unfortunately, it's a bit of a search to find those that accept just Medicare. Most accept the Medicaid clients, but Medicare does have some barriers. But I did find a couple of agencies that do accept Medicare. Jackson County Therapy is fairly new. They offer free consultation, EMDR, acceptance commitment therapy, DBT, life skills, peer support, case management and care coordination, and specialized therapy groups, but just wanted to really highlight them because they do accept the Medicare only. And then as well as Oregon Behavioral Health Group, they are located in Central Point, again, accepts Medicare, and they offer the following services. Now, Columbia Care Services, they offer both outpatient and inpatient. They do not accept Medicare, but there is some grant funding. So like their Beckett Center, their licensed residential crisis that's for short term, there's a referral process for providers to be able to get their patients in if they are in crisis and need a short-term respite of residential. But here is their list of treatments. Of course, they have a mental health access and assessment in order to be able to get into services. That's offered Monday through Friday, 8 to 2. It's a first come, first serve basis. They have outpatient services, supportive housing, licensed residential treatment, secured licensed residential treatment, and then the Beckett Center. Now, options for Southern Oregon, they are the community mental health program for Josephine County. They have offices both in Medford and their main office is in Grants Pass. My counterparts through the Oregon Older Adult Behavioral Health Initiative, they are for Josephine County, they are employed through options, and we collaborate pretty closely on our workforce development trainings, our community education, several projects. But Options offers therapy, case management, peer support services, skills training, assertive community treatment, mental health court, supported employment. But they also partner with Colpia Counseling Services, and they are a state certified DUI program in Jackson County. Now, Rogue Community Health offers the behavioral health. They are the one of the federally qualified health centers here in Jackson County. And in order to be connected with their behavioral health team, it's an integrated plan where you have to be connected with the primary in order to receive support through their behavioral health. So it's not just a behavioral health section of community health, it's all integrated. And that would be the same for La Clinica as our other federally qualified health center. That you are connected first to the primary and then the behavioral health. But I do want to point out that the La Clinica has the Learning Well, which just has a ton of wonderful health and wellness classes. You do not have to be a patient to take part in their health and wellness classes. Many of them are free. And also just wanted to point out their winter spring grief support. Winter spring used to be on their own, but they have partnered now with La Clinica. They offer grief support and education. All groups and classes are free. The support groups are 6 to 8 weeks, and their programs are for bereaved parents, a children's program, navigating the stormy seasons of grief that really focuses like the holidays, with the holidays coming up, spouse and partner loss, suicide loss survivors, growth and resilience in a changing world, and then yoga for grief. So that's great. And then I just wanted to share that Southern Oregon Friends of Hospice, or Celia's House, offers a monthly death cafe. It's a group-led discussion of death and dying with no agenda, objectives, or themes. It's a safe and friendly space to talk about a taboo subject. As I said, those are Dwight Wilson, who is the executive director of Celia's House there. He kind of facilitates the group, but they have also, I guess, just formed the Southern Oregon Living and Dying Alliance. And I do know that the two that help facilitate the class there are from SOU, or they're students from SOU focusing on geriatrics. And then Rogue Valley Council of Governments, or RVCOG, is our local area agency on aging, and also the Senior and Disability Services. They serve both Jackson and Josephine counties. They do have some behavioral health programs for seniors. I'll talk about those in a second. They have family caregiver support program. They are the ones that actually facilitate the Oregon Project Independence, and I'll talk about that in just a minute. Food and Friends, and then the Senior Advisory Council, and we are always looking for new members if you have an interest. So I just wanted to throw that plug there. They do offer a PEARLS program, which is a program to encourage active and rewarding lives for seniors. It is problem-solving treatment, social and physical activation, and pleasant activity scheduling. This is offered as for older adults with minor depression or dysmorphia. This is a brief intervention program delivered in the home with 8 visits and 4 follow-up calls over a period of 6 to 8 months. There is no insurance requirement. I do know that they have a little bit of a wait list, but they do move through it fairly quickly. And they do have 2 staff there that do their PEARLS program. This is Rogue Valley Council of Governments Area Agency on Aging, and this is actually their 2025 program guide. The other behavioral health program you can see at the bottom on that first page is their OPAL program, which is options for people to address loneliness and isolation. So using behavior activation, action planning, and resource identification, OPAL counselors provide support and encouragement to reduce stress, anxiety, depression, and feeling of loneliness and isolation. OPAL counselor partners partner with participants to address the problems or concerns they experience around loneliness and isolation. And this brief intervention program is delivered through 6 weekly in-home sessions and 2 follow-up monthly calls. Again, they are payer blind. There is no insurance requirement. And there's a lot of connection time that those counselors spend connecting to local resources, helping older adults engage, and really starting that behavior activation towards improved quality of life. Now, Organ Project Independence, or OPIM, for Medicaid has been around for a while. But just in March this year, Oregon DHS launched the Organ Project Independence. So it's available to seniors who are 60 years or diagnosed with dementia or Alzheimer's. It provides up to 20 hours per week of either housekeeping, personal care, home delivered meals, also offers that case management and any kind of assisted technology to connect to other services. The OPI income standards, the graph that I got this data from was just until June this year, so it may have changed a little bit, but the gross income limit is about $5,000 a month, which most seniors on Social Security qualify for. And then the resource limit is just under 100,000 in assets, but then it's anywhere from 6 to 20 hours a week of services, just that companion service support and case management. You do apply through ODHS and Senior Services for intake and eligibility, and then it is the ADRC, or Senior and Disability Services, that actually provides the case management and caregiving piece. I'd like to point out Pacific Retirement Services, and specifically Community Volunteer Network. They have wonderful programs, but their one behavioral health program is the Age Wise, Age Well peer counseling for older adults. They are a mental health support program that utilizes older adult volunteers to provide free peer counseling to seniors. It's a one-on-one. It's for those that are 60 years or older. You would call and do a phone, or the patient or the client would call, do a phone assessment to see if they're fit for the program. Counselors and clients meet for 1 hour a week, every week, either in person, by phone, or over Zoom. There is no minimum or maximum amount of sessions, and it is also a free program. I just also want to share that they facilitate the foster grandparent program, which is part of AmeriCorps Seniors. So it's for low-income seniors. They receive a stipend that through AmeriCorps. But anyways, it is volunteers that go in and work with children in the schools, and that serves both Jackson and Josephine County. They also facilitate the Call a Ride program. So for seniors that only have Medicare, don't have the Medicaid component of TransLink for transportation, but their Call a Ride program is for seniors who have Medicaid, are able to, pretty actively navigate where they need to be in their appointment times. They just sign up for the program. It's run by volunteers. There is also a stipend for those volunteers for gas, but also provides a great connecting point for seniors who are isolated and lonely, and gets them to their medical appointments. You just have to be registered and call at least 24 hours in advance to schedule your rides. Community Volunteer Network also does the SHEBA, the statewide Oregon SHEBA program, so the Senior Health Insurance Benefits Assistance. And actually, since open enrollment is soon coming up in October, and I do know that SHEBA, or Community Volunteer Network, has a presentation next Monday at the Ashland Senior Center. They provide a wonderful educational class, and then also have all the next year's booklets for Medicare and as well as the Advantage plan. And their counselors will work with seniors to help choose what's right based on their unique needs. Community Volunteer Network also does a senior Medicare patrol, and they are affiliated with Pacific Retirement Services. Hearts for Seniors, which is part of Hearts with a Mission. This program just started about 2 years ago, and it's a companion care program. It acts as a bridge to independent living. It's support for socially isolated seniors by providing regular companionship and social interaction and hopes to improve the quality of life. It's free. It's for seniors that are 65 and older, living independently and isolated. So this program just started in Jackson County 2 years ago, and just this last year, they've expanded to Josephine, Klamath, Coos, Lincoln, and Douglas counties. So it's really taken off. On their website, which I provided the link there, you can watch a video about the program. There is an enrollment form that you would fill out through their link on the internet there, submit it, and a program coordinator gets back to you. They work very closely to find a good fit for a volunteer that meets the needs of that senior, so that might have some lived experience. There is a bit of a process time finding those right volunteers to a right fit, so there is a little bit of a timeline there, but it's a great care companion program. The National Alliance on Mental Illness, they actually have received some funding. They just had a conference here actually earlier this week, and at our Health and Human Services building. And they received some recent funding, and they're really expanding throughout Oregon, which is great to see. They have several support groups in education. Many of them are online and in person. The Family to Family class, which is an 8-week class, it actually started yesterday evening, and will go for 8 weeks. They will also offer a class in the spring. And as I said, it's virtual, in person, and they do also have Spanish classes. They hold a monthly community partnership meeting. Anyone can join by Zoom and share whatever's happening in their organization or any barriers that they're seeing with regards to mental health in our local community. They offer a NAMI Smarts for Advocacy skill building class. We do have a NAMI library here at Health and Human Services that's open during the day, staffed by a NAMI volunteer. So they're a great resource. Again, it's on their website to get the Zoom link for their virtual groups or to find out more information about how to get involved. Okay, now I'll move on to the substance use recovery centers in Jackson County, well, Jackson and Josephine, but Addictions Recovery Center offers a withdrawal management. The next slide I'll show in just a minute. They have just remodeled their withdrawal management building, so they have a higher capacity now to be able to help those that are going into withdrawal management. They offer engagement and assessment, residential treatment, medicated assisted treatment, outpatient services for both co-occurring mental health and substance use. They offer the DUI classes. They have an LGBTQ plus group counseling, gambling addiction, and they support the Recovery Opportunity Court. So here's actually the flyer for their open house that they just had for their Fresh Start withdrawal management. But so that's exciting. And then there's the Medford Comprehensive Treatment Center for opioid use disorder programs. So connecting with them is either through that phone call or completing this form online. They're located in Medford on Murphy Road. And so you can go ahead 24 hours a day, 7 days a week to schedule your appointments online. and get connected. The Medford Recovery is part of the Oregon Recovery and Treatment Centers. Again, it's similar, filling out that sheet online. They're located on Biddle Road, and most of their medication hours and counseling hours are in the morning, Monday through Friday. On Track Rogue Valley, and they just changed their name last week to Continuum Behavioral Health. They support both Jackson and Josephine County. They offer outpatient and residential services. They offer services in Spanish. On Pace is a peer and counselor education. They also have an apprentice program for certified alcohol and drug counselors. And then they are opening up Cobblestone Village, which is a family residential treatment campus. That's coming soon. Reclaiming Lives Recovery Cafe is nationwide, but we do have a local one here in Medford. Small groups that meet are recovery circles that meet once a week. So you can see on the left there, I pulled this from their website. Monday, it's relapse prevention. Tuesday, beyond recovery. Wednesday, healthy relationships. Thursday, building self-esteem. And Friday, stress reduction. They also offer a dinner, 4 p.m. on Sundays. Invite anyone. They would like you to be a member. They offer peer support resources, groups in Spanish, and all services are free. And they also ask you to volunteer as part of recovery. And then the Rock Recovery Center, which is a personalized recovery coaching, faith-based, individual and family counseling, intensive outpatient groups, addiction and recovery education, peer support, peer training to become certified. And then they just had their Strong and Courageous Recovery Festival at Lithia Fields, where multiple community partners support and really bring in the community to support. And then Rogue Retreat serves homeless and unsheltered people living in Southern Oregon. They offer multiple which you can kind of see in the picture here, shelters and community housing. So the congregate shelter on the left, and then their tiny homes in the middle there, and then some bigger options for families. Independent long-term housing, peer support, case management, and job readiness are the services they have. ORA, which is Opportunities for Housing Resources and Assistance, is they have an Ashland Resource Center. They've received quite a bit of grant funding. They do have a shelter, a non-congregate shelter, where people are able to stay for six months. That is low barrier, fully staffed, 24 hours a day. They have housing and resource navigators that help people avoid eviction, find housing, apply for benefits, access physical and mental health services, and find employment. I do know that La Clinica has a trailer that they come out to support ORA residents or those that are there seeking services. They have a shower trailer and laundry services, and actually a brand new kitchen that they've just finished recently. And so they are a wonderful agency and really go the extra mile with their resource navigators and helping support those. But there is that 6-month limit of actually being able to stay in their non-congregate shelter. Unite Center for Farm Worker Advocacy is a resource and advocacy agency. They offer resource navigation, community education, and advocacy, connecting to mental health, any kind of support. And actually, on the 20th, they have a resource fair and state and local agencies there to answer questions. Again, that system navigation, connecting to support. So I think they have these resource fairs fairly often, maybe not once a month, but really there's a lot of support from the community. I know that Health and Human Services is connected with Unite. I believe there's a Spanish group that meets as part of Unite in our building here. I also just really want to point out Rogue Valley Senior Centers. We have 4 senior centers that are actually designated senior centers, and then the Jacksonville community in Rogue River and Upper Rogue. Those are also, they're called community centers, but they're also senior centers. I'd really like to point out the Ashland Senior Center. They really provide that wraparound support for seniors, connecting them to resources. They offer the congregate lunch program. They have games, physical activities, movie nights, just all kinds of services and all kinds of support from community partners. I often teach some of my health and wellness classes. I am in each of the senior centers at least once a quarter. I also do a lot of programming through the Jacksonville Community Center. Grants Pass has one senior center, which is the Grants Pass Senior Resource Center. They are connected with Team Senior and have a Club 60. My counterpart in Josephine County, she hosts a Wellness Wednesday for community partners and seniors to come in. Anyways, it's been a great success. I also just want to point out park and recreations departments. I'm teaching a health literacy class that I'll talk about in the next slide at Central Point Parks and Rec in October. And I just showed a picture of this guide here, the fall guide. There's at least 4 or 5 pages of senior programs, guided hikes, cooking, swimming, everything you can think of. Rogue X also hosts fall prevention events, and October 14th, they have a Medicare Advantage Fair, which is a big fair. It's in their big, I guess where their basketball court area is, but they'll have all kinds of different agencies that do the Medicare Advantage plan. They'll have breakout groups in some of their classrooms, but it's also a fair. So that's October 14th coming up. So really a great way for seniors just to get connected and, mitigate that loneliness and the social isolation. So I really want to suggest that there's a lot of opportunity for support. And then Ollie, part of SOU, is just a vibrant community of older adults. I'm currently teaching a healthy brain and aging class that actually starts tomorrow. I have 34 people registered for the class and a wait list, so I'm excited about that. We focus on social connection, sleep, self-care, cognitive engagement, physical activity, and nutrition. And then in the winter, I'm doing this age-friendly health literacy as part of my community education. So I utilize materials from the National Institute of Aging. You can see on the left a guide for older adults and talking with your doctor. We talk about the 4 M's framework of what matters: medication, mentation, and mobility. I also review how to report abuse for older adults and people with disabilities. We talk about the different kinds of abuse. I also share many of the local resources to get them connected. This is a 3-series class. And then this is part of our upcoming GERIO competencies workforce development training. As I talked about at the beginning, we offer 2 NASW CEUs. We're trying to get the CMEs. We just haven't gotten that far yet, but we have Dr. Maureen Nash, who is board certified in psychiatry and internal medicine. She will be talking about managing challenging behaviors in residential care settings. This is usually the second Thursday of the month from 9 to 11. And as I said, we offer CEUs. And then we have in November, Hope for the Rest, Plan for the Rest, navigating a life-changing diagnosis with Dr. Winemaker and CO. And they are part of the waiting room revolution. They've written a new book, Hope for the Best, Plan for the Rest, which are designed to help make palliative care approach accessible to all patients and families. And so anyways, we plan after November. November's our last training for this year. We plan for our upcoming year, and we've really seen the amount of community partners that attend our workforce development trainings increase, and it really kind of creates a stakeholder group of those that serve seniors in both Josephine and Jackson counties. So I would encourage you, if you have interest, please attend. As I said, it's free. And then I just am excited about our fall prevention event that we're partnering with Providence. Next Tuesday, September 23rd, Dr. Shaw will be providing a fall risk education. We'll have some pharmacists there from Providence that will talk about medications risk and falls, Tai Chi demonstration, physical therapy demonstration. We'll have goodie bags. And last year we had 22 community partners table the event, and we had 70 seniors attend. So this is exciting. We have a coalition of Fire District 3, Aging and Disability Resource Connection, Mercy Flights, Oregon State University and their Walk with Ease program, Jackson County and the initiative in Providence. So I just wanted to do that shout out and thank you for that collaboration and that partnership. Really, it is the highlight event of the year for me. So I'm a little bit early finished, but thank you so much. I just want you all to know that I am a resource to the community. And if you are having any barriers connecting older adults and through that system of care with behavioral health or really anything, I serve as that resource to the county that I serve. And I'm very passionate about the work that I do. I love it. And I feel very fortunate. So thank you for allowing me to share today.
Thanks, Janine. That was an awful lot of information, and what you said at the end was one of my questions, because that was so much information that I don't think I could keep straight. A provider could just contact you directly for some advice, where to go, what resources are out there.
Yes, or any of their staff, anyone. Yes.
Great. I was curious, like with the senior loneliness line, that's something I had heard about a long time ago, but again, it just doesn't stay in my head. Is that used very much, or those different programs?
Yes, definitely it's used. I don't know how many volunteers or counselors that they have there, but we're well connected. It's Lines for Life that puts it on. I wish they would change the name from the loneliness line to the friendship line. With that stigmatism, it's a little bit difficult to encourage those seniors to call when it's the loneliness associated. So, yeah, but it's a wonderful resource, and it is staffed by older adults, and it's from 5:30 in the morning till 11 at night. So it's a way to connect. Oftentimes, it's just that listening ear and having someone to talk to is what a lonely and isolated senior needs, just to make a difference in their day or to connect them to local resources that might be able to help them more.
Yeah, great. And the activity guides that you showed for the fall, do those get distributed to clinics?
You know what? It's a bit of a challenge getting the print guide. They do mail them out. That one for RogueX or Medford, they mail them out to all houses in Medford. But I've gone in to ask for more, and it's a bit of a challenge. They only print so many. I do share them in my classes, but I'm only able to get about 20 or 25 each time. They really are encouraging everyone just to go online. Everything's becoming paperless.
Right.
Yeah. But you can go into RogueX or any of their Parks and Rec and pick one up.
Okay. And are there significant differences among the senior centers in the community? What kind of things they offer?
Not too significant, but some. It's really about the vibrancy of the programs and the people that really staff the senior centers. And I do know in Ashland, they're very passionate, and they have so many programs. The Eagle Point Senior Center, it's a little bit of a smaller community. And they've had some changes within their staff, but it's still, bingo is the big draw there out in Eagle Point. Eagle Point has a men's group, which that's the only senior center that I know that has a designated men's group. So yeah, it's just, and I'm trying to think, the Central Point Senior Resource Center, which is affiliated with RVCOG, they have a few classes, but mainly it's the lunch, and it's not quite as well attended as, like, say, Ashland. Ashland often has a wait list for many of their classes. It's a higher demand.
Yeah. As a provider, when we think about older adults and mental health, one thing that I think most providers struggle with or comes up a lot is agitation in patients with dementia, and we wish we had more geriatric psychiatry resources. So I'm thinking that the OPAL A would be maybe something for us to use.
Oh, I have some, well, actually, I can send a link and I'll send it on to Linda after. But the National Institute of Aging has wonderful resources about dementia, and they have this wonderful sheet on the agitation, the sundowning, and what to do. It's just a quick sheet. Actually, I can send that sheet along as a PDF file too, but many of the resources that I share in my classes come from the National Institute of Aging.
Thanks. Give it a minute to see if any other questions come in. Yeah, I appreciated the assessing capacity links too, because that's another thing that comes up frequently for providers.
Yeah, we have a bunch of wonderful fact sheets. I just pulled a few, but it really speaks to the work that we do across the state. There's a lot of statistics as PSU evaluates that, and they generate an annual report to OHA and the public. So I would encourage you to check out our fact sheets.
Great. Well, I'm not seeing any other questions, so thank you very much for all the information today. Yeah, I'm surprised there's so much out there that I didn't know about. So,
yeah,
there
really is. Thank you so much for having me and letting me provide this information. And there is a lot out there, and sometimes it's just planting a seed to share with seniors or your patients that there are resources out there. A lot of times what I find is when I share, they're not interested, but it gives them some time to think about it. And then maybe the next time we have that conversation, then they're a little more open, and really being able to hand them a paper or, I often email links to these resources so that they can go back at another time if they're not quite ready to make change or get connected at that time, but allows them to think about it and possibly engage at a later date, and that they have that right at their hands. And actually, we talk about my class tomorrow, the Healthy Brain and Aging. The first class is all about social connection and recipes for connection, and we engage as a group and talk about it. We go away from the first class and practice socially connecting, and then come back that next day and talk about what worked and what didn't work, and everyone shares their experiences or where they connected to give ideas to others in the class. So
yeah, that's great.
It's fun.
Yeah, well, thank you again. And We'll see everybody next month for our October Grand Rounds.
Thank you. Thank you so much.